This video helps explain the information that I sent you in the email. This is the inside cover of the Small Business Association brochure. Column A explains what is covered by the hybrid option A no deductible plan. Column B is the $500 deductible plan. You'll notice first that the coverages are higher with the $500 deductible. The other thing you'll notice is that these are the maximums, and you'll notice this is unlimited for these coverages. Now make sense of this using this pricing sheet. Basically, let's take an ACL knee surgery. It's $1,800 for the actual surgery. It's $1,112 for the facility cost. So when we're talking about these coverages in these columns and these percentages, they relate to these example prices. Now these prices are taken from the standard pricing using this schedule, the Medicare costs. Now the doctor knows what Medicare covers, and Medicare covers pretty much 100% of what a doctor would charge for certain procedures. So they use that as a pricing index. So anything that Medicare covers, we more than cover, because we cover 150% of what Medicare would cover. Now, even though you may not be on Medicare, if you're under age 65, you're not going to be, you know that we'll cover more than what Medicare would normally cover. So when you walk in with your card from the SBA and CIGNA, that doctor knows that you're going to more than amply cover his cost for any one procedure. Now let's make sense of these percentages on this schedule here. For example, $1,800, this 20% right here covers the 20% of this surgery cost for this second assistant surgeon. So that's what that relates to. So if the surgeon who gets 150% coverage for that operation, $1,800, so does his assistant. He gets 20% of that. So he's more than covered. As well does the anesthesiologist, etc. So that's what these percentages relate to in terms of these example costs. I have included in the email this brochure, this cost sheet to give you examples, as well as the rate sheet for your monthly cost for health coverage, which I will go into, as well as an application. If you are an individual 45 years old, you can expect $140.59 monthly, plus the $29.95 per month membership fee and a one-time $50 enrollment fee. So for your age as an individual or a couple or family, those are the costs for hybrid option A, no deductible, as it relates to these options and costs. And then for the $500 deductible, individual, couple, family costs. That's it in summary. Our brochure, our monthly costs, a breakdown example of how this pricing works. So for example, if you go in for surgery, these are the costs. If you have a $5,000 deductible plan, like with Blue Cross Blue Shield or Humana or Aflac or something like that, you're going to have to come out of pocket this much money, because this plus this equals this. Assurant, just for example, Assurant is a large company. This is what they would cover, and then you would be responsible for this difference. That's just an example. I don't find a lot of Assurant members in this area, but that's an example of a very large company, what they cover. So by comparison, CIGNA, under hybrid plan A or hybrid plan B, this ACL surgery pays this much with hybrid A, so you'd have to come out of pocket this much because there's no deductible, and they would pay this much. If you have plan B where there's a $500 deductible, it would cover this much, meaning there's a difference in overage, and you would receive a check back, which is very unique to us. So this is their allowed, this is the cost, that's the difference that you would receive back, because this is what we would cover under plan B. So it's rare that an insurance company would pay you back for a procedure.